Hey guys, this is Dr. Hub. Today we look at the amyloidosis. And we are looking at the classification. So under this, first we will look at the systemic, that is a generalized amyloidosis. So systemic, that is a generalized amyloidosis. So what does it include? So there is the immunoglobulin light. There is immunoglobulin light chain amyloidosis. So light chain amyloidosis. So this is nothing but the primary amyloidosis. Then there is also, it is seen in multiple myeloma. It is seen in multiple myeloma and also the other monoclonal plasma cell proliferation. Also the monoclonal plasma cell proliferation. So what are the major fibrin protein involved? The major fibrin protein involved here is the AL. And what are the chemically related precursor protein? That is, it includes, let's write it down, chemically related precursor protein. So next time we'll be writing it as PP, that is a precursor protein, is going to be the immunoglobulin light chain, and it is chiefly the type. Then next one we are going to see the reactive. This is the reactive systemic. There is reactive systemic amyloidosis. That is, it is nothing but the secondary amyloidosis. And this is seen in case of the chronic inflammatory conditions. So here the major fibril protein is going to be the AA, and looking at the chemically related precursor protein, it is going to be SAA. This is all the reactive systemic amyloidosis, that is the secondary amyloidosis. Then we will look at the hemodialysis associated amyloidosis. So the hemodialysis associated amyloidosis. So here what and all does it include? So this is seen in terms of the chronic renal failure. Seen in the chronic renal failure. And what are the major fibril protein? The fibril protein is nothing but the A beta 2M. And what about the precursor protein? The precursor protein is going to be beta 2 microglobulin. Next we look at the hereditary amyloidosis. Hereditary amyloidosis. So what does the hereditary amyloidosis contain? We look at firstly the familial Mediterranean fever. There is a familial Mediterranean fever. So what are the components? We look at there is a major fibril protein, that is going to be AA. And what is a PP? PP is a precursor protein. Precursor protein is going to be the SAA. Next we move on to the familial amyloidotic neuropathies. So here it includes the ATTR. So the ATTR, fibronectin fibril protein, and the precursor protein is going to be the mutated, there is mutated transthyretin. Next is the systemic senile amyloidosis. The systemic senile amyloidosis. So systemic senile amyloidosis, it involves the ATTR, the systemic senile amyloidosis. The fibril protein is ATTR, and then what is the precursor protein, it is going to be the normal transthyretin. Then we are going to look at the localized amyloidosis. The localized amyloidosis. So the localized amyloidosis, it contains the senile cerebral amyloidosis. So senile cerebral amyloidosis as well as seen in Alzheimer's. So what are the fibril proteins? The fibril proteins in case of the senile cerebral amyloidosis and senile Alzheimer's disease is A beta. And what is the precursor protein? It is APP is the precursor protein. Then we move on to, there is what are the other categories? It also includes the endocrine disorders, and this such as the type 2 DM. Then we move on to the medullary carcinoma thyroid. So it is MCT, that is a medullary carcinoma of the thyroid. So here the fibril protein is the ACAL, and what is the precursor protein is going to be the calcitonin. Next we move on to the islets of Langerhans. So under the islets of Langerhans, what will be the fibril protein? It is going to be AIAPP. And what is the precursor protein? It will be the islet amyloid peptide. Next, lastly, we are going to see the isolated atrial amyloidosis. So isolated atrial amyloidosis. So here it is the AANF. This is the fibril protein. And next we also have the precursor protein. This will be the atrial natriuretic factor, or in short is known as the ANF.